Healthy Choices, helping you live healthier. Sponsored by Intermountain Health.
Welcome back, everyone. Home visit programs help expectant mothers and parents of young children. Dr. Angelo Giardino is the chair of the University of Utah School of Medicine's Department of Pediatrics and chief medical officer at Intermountain Primary Children's Hospital, and here to tell us more in the sponsored interview. And you were telling me that home visits have been around for 30 years in our community. Tell us why it's been around and why it's so successful.
Well, it really does what you need to do if you want to teach parents how to be great at parenting. It forms a relationship and it shares information, but it shares it in a way that's strengths-based. So it's, you want to be a great parent and we're going to help you be that great parent, rather than you have a deficit and we've got to fill that need.
And this truly targets maybe new expectant mothers, young moms, you were saying?
It oftentimes is targeted to, we call them young first-time moms, but it's not just limited to that. But that's usually the most prominent group, just because they have the most information needs and they're most motivated to kind of learn all these new skills because they want to do a great job.
April is Child Abuse Prevention Month, and this is kind of in coordination of preventing maybe possibly the risk factor of child abuse in the home. And tell us the benefit of having someone from the medical field, the healthcare field, visit and do home visits.
So all of these programs started as child abuse prevention programs, but they do so much more, because in addition to truly preventing child abuse and neglect, they actually promote excellent parenting, and they also help the mother and oftentimes the father really think through what they want to do for their family. And they develop some skills in parenting as well as life skills.
How would it work? A mom comes to the doctor's office and mom says, hey, I might need some extra help. I might need someone to come and visit the home, or does the doctor suggest and recommend?
It's actually both. So sometimes moms will say, you know, I wish I had a little bit more coaching because you know, I'm anticipating the baby's arrival and I want to be great at this. And oftentimes it's the OBGYN or the midwife who says, you know, we have this great program. This is all new. No one is born knowing how to be a great parent. So do you want some extra help? Do you want some coaching? We have this program where a professional will come into your home, will coach you, will give you some information, will be supportive of your journey to be a great parent.
And doctor, here are some benefits here. Educational resources as this healthcare provider comes to the home, parenting help, emotional support. Why are home visits so much more effective than, say, you're taking a course, mom and dad expecting their first child, and they're sitting in a classroom, versus truly someone coming into the home, walking you through certain resources and
education? It's all about the relationship. So what we know in being humans is that we actually learn more if we're learning in the context of a supportive relationship. And it's even better if that supportive relationship is strength-based, where like we know you want to be a great parent, so we're going to help you build that toolbox so you can be a great parent. That's like the perfect way to teach stuff.
And home visiting programs can help all of those aspects there: child and maternal health, cognitive development, behavior and school performance, and reduce substantiated child abuse and neglect. All so important. Who's coming to the home?
So it depends on the program. So there's some programs where it's a registered nurse. There's other programs where it's someone with a social work background or an education background. So it's usually someone from the community. They have some training and they follow a curriculum, but the programs vary a little bit.
And doctor, this has been so effective that at Primary Children's, you're expanding this program.
Sure, we have a program called Primary Promise, where we're really reaching out to the community and asking for them to help us with the resources so that any parent in Utah who would want to have the benefit of a home visiting program could get it.
Doctor, I think this is so important and so effective. I think more people need to know about this program and to help support and learn more about this kids initiative, Primary Promise, right there on your screen. And we'll put a link on ours as well. Thank you, doctor, so much.
Thank you.